You're listening to The Physician's Mind, raw stories and real talks from people striving for greatness in medicine and in life. This is where ambition meets action and where the relentless come to level up. I'm your host, Curtis Wilkerson. Thank you so much for listening. Let's get right into it. Today we're joined by Dr. Emily Cordes, a dual-trained internist and pediatrician who's embraced functional medicine to tackle chronic disease at its root. In this episode, you'll learn how Dr. Cordes approaches healing through nutrition, team-based care, and addressing the root causes, offering practical insights to reverse chronic disease and optimize your health. Hello, everybody, and welcome back to the Physician's Mind podcast. I'm your host, Curtis Wilkerson, and today I'm honored to be speaking with Dr. Emily Cordes. Dr. Cordes, how are you today?
Good. How are you doing?
Fantastic. Thank you so much for joining me. Let's get right into it. So you trained in both internal medicine and pediatrics. What originally drew you to those specialties, and how did that dual training shape your perspective on whole person care?
So, as you know, all doctors can attest to, and as you'll see throughout medical school, you get to see the gamut of what you could possibly go into. I wasn't really drawn to like one part of medicine to start off with. Some people hit day one of medical school and they're like, I'm going to be a surgeon and nothing but a surgeon. As I rotated through, third year and saw once you get into it, you really figure out that you either, the first divide is like you either are a surgeon or you're not. And I think you're born with it or not. And I was not, didn't enjoy it at all. So I was shocked at how much I really enjoyed internal medicine. And frankly, like pediatrics is pretty much internal medicine for little people, right? And I liked the depth and the mental side of internal medicine where you could really like dig into a problem, figure it out as a puzzle. That really it drew me to it. So as much as like people complain about 8 hours of rounding, I was like, oh, this is like 8 hours of figuring out a puzzle, right? So and then when I heard I could do both internal medicine and pediatrics and become board certified in both in 4 years instead of 6, I was all excited about that. It also it left a lot of opportunity for growth. It's usually not a residency program where the majority of those residents do not stay in internal medicine and pediatrics. They decide to go on for fellowship. Obviously, they could do primary care as I did for a hot minute. But it really, it encompassed sort of the whole person, right? Cradle to grave. Cradle to grave, except for OB. It's just not something I was interested in. You deliver a couple babies and you're like, once again, you either love it or you don't. And I just didn't. So, I liked the age ranges, but I wanted the depth of, every differential, every diagnosis you have to learn to be an internist and a pediatrician. So, yeah, just the right fit.
Beautiful. And you attended the Michigan State College of Osteopathic Medicine. Go Spartans. That
Yeah.
school emphasizes the osteopathic philosophy. So how did your osteopathic training influence your approach to medicine from an early standpoint, and how does it guide you in your current practice?
Yeah. It goes back to that, like seeing your patient as a whole person, right? They're not an organ. You're not, just dealing with the diagnosis. And I think that's something that I would, frankly, at this point, I would hope that like all medical schools, regardless of DO, MD, that is the philosophy that should be taught. I graduated from medical school doing some quick math here 10 years ago. Oof. And even, I guess, in the 10-year time period, I think society has changed a lot to really look at patients as a whole person. And 10 years ago, that is what the DO route definitely offered. And I guess that's always just stuck with me, that these people that you are interacting with and treating and getting to know, they're real humans, and they are not a constellation of symptoms or something to be treated and then seen in a month.
Absolutely. Yeah, and I agree with what you said. That should be something that any good doctor recognizes, and I think most of them do.
Yeah.
So were there any turning points in your journey from conventional training to practicing functional medicine where you do now at Root?
Yeah, there wasn't like one huge turning point. I think there was various pivot points along the way. In residency, I had a lot of opportunity to do a lot of inpatient intensive care work. Really enjoyed it, honestly. There's something sort of thrilling about that, understanding how all the organ systems interact and how you can really save somebody from the brink of a pretty big disaster. But, at the end of multiple of those shifts, I would sit there and think about like what really brought this person to an ICU bed, right? And their disease started 20, 30, 40 years earlier and then ended up in this sort of dire strait, right? I thought, gosh, why are we not doing a better job 30, 40 years ago of preventing this stuff in the first place? Now, people get sick, right? Like there's a time and a place for intensive care, and of course it's necessary. But at that point in residency, I thought, we need to look upstream, right? These problems develop earlier. So I thought, okay, primary care obviously is where you deal with upstream, right? You meet people and you see them more frequently, and you get to talk more about lifestyle and really what the root cause of eventual problems are. And I was very glass half full leaving residency, thinking that, like, oh, primary care is going to go save the world. And, after a couple years, I think you realize it's not like that. I became rather disillusioned with seeing people back, month after month, every 3 months, and, just let's just increase the meds. And, you don't see quality of life improve significantly. And you just see this general decline. And frankly, you even see it in physicians treat other physicians, right? And we see even when our physicians are coming in to be treated, it's the same general, like, not great progress, and you're not reversing anything. And I thought, gosh, like this pill for the ill mentality of naming the diagnosis and then giving the right medication, although it works acutely for chronic disease, it's really lacking. And I just said, there's got to be a different way. There's got to be a different way of thinking about problems. So then I looked into functional medicine among other like various pathways, and just felt like it was the right one to land on, seeing the person as an individual, but also looking at like what their upstream root causes of disease really are.
How would you describe optimal function in a clinical sense? And how would you say that contrasts with what's typically emphasized in conventional medicine?
Yeah. I think the easiest way to think about this is actually if you think about your car. So, right? So, okay, you're driving down the road and a wheel falls off. You need a mechanic, right? Like there's something, your car is no longer running and you got to get it fixed. That's a very easy way of, it needs to be fixed. But and that I think is a lot of conventional medicine. We wait for symptoms to crop up, labs to look extremely abnormal, and we can name that the wheel has fallen off, aka name the disease, and then put the wheel back on, either surgically or possibly like, is there a medication that fixes that? And there is a role for that type of medicine. But in chronic disease, if we're trying to look at like what's optimal function before someone heads down that chronic disease pathway, we're trying to figure out why their check engine light might go on, right? Your check engine light goes on way before you've got a problem. That is the point of those lights. So, optimal function needs to be usually dug into in both conversation, right? How do they feel on a day to day? Do they feel the best they have? But also in a lot of advanced lab work that isn't done in most primary care settings. So the combination of those two things can really help us figure out what optimal function looks like. It's hard to say that optimal function is a set of lab work and a set of lab results because it is an individualized approach. One person's optimized function is going to look different. Mine is going to look different than yours. And I think when we say, oh yeah, like this level should be less than whatever, that's not the right way to look at it to meet certain thresholds.
Yeah, yeah, that's a great analogy. Trying to address the problems that prompt the check engine light rather than addressing it once the wheel has fallen off.
Right.
Interesting. Yeah. So, as a physician at Root, you're working as a collaborative team. You have physicians, dietitians, and the patient working all together. What do you think are some of the big advantages of that kind of model?
Yeah. So this model, gosh, this is like the core of root functional medicine. I can't do my job without a registered dietitian. And I think there's a lot of folks in the functional medicine space that maybe they have more nutrition education than I do, but I think they're claiming that they can do it. They can't. NRD has a master's level, of understanding of nutrition. So the key is that it is a team-based approach, but the RD does a lot of intervention, right? I do not know how to counsel somebody on breakfast, lunch, and dinner, day in, day out, repetitive meal planning, etc. And those skills, although we may gloss over them in medicine, right? We know that a good, proper nutrition plan is the foundation of treating lifestyle disease. So Yeah, it has to be a team-based effort, which also means that me as a physician and working with one of my RDs, we can sit down and make this wonderful plan. We know what the labs are, we know what the patient should do. In 6 months, everything's gonna be, reversed, and we're so excited. But after you talk with somebody and they're like, "Oh, that does not work in my lifestyle at all. Like, I have to work 60 hours a week, and I have kids to pick up and, normal life. I mean, I've got this stressor that's not gonna be leaving." That's actually where the fun comes in, where that more important team member, the patient, comes in, and that's where the boots on the ground come in as far as, like, we gotta make some changes, and how do we do this in a realistic sense?
Okay, and I know there's a lot of contention about nutrition and what's optimal and what's not, and there's a reason there's 40,000 plus books written on the subject, but would you agree that it's largely beneficial to focus on a mostly organic diet, avoiding processed foods, refined grains, refined sugars to start? Would you agree that that's a good starting point?
Yeah, I think we can just summarize it that you should eat whole foods. That's
Mhm.
the easiest way to think of it, meaning that you need to go eat what grew out of your garden and what got killed in a field, and not, what got smushed together and put in the frozen section.
Yeah, well said. And to follow up with that, functional medicine often dives pretty deep into gut health, into hormones, and into inflammation. What conditions do you see that are misunderstood or overlooked in a conventional care, but respond well to functional approaches?
Yeah, yeah. I would say when we think of this question, I would say is sort of like, yes, there are certain diseases that do really well in the functional medicine model, but there's also people who generally just do not feel well and they've been told they're fine.
Mm,
And I think we'll talk about the diseases in a minute, but I think those folks are actually, I find them super rewarding to work with. So people that have seen other physicians and have just been sort of pushed to the side because they can't find a active disease pattern, meaning, they don't have the easy lab abnormalities, but when you dig into what their day-to-day looks like and some advanced lab panels, I can pinpoint like, oh, that's why you don't feel great. So there's sort of the generally unwell feeling, which I think a lot of Americans sort of fall into when you start asking them. When we talk about true diseases, anything metabolic, so the diabetes, cardio prevention, functional medicine works well in that. Autoimmune conditions, very strong evidence to say that we can support autoimmune conditions, either the prevention of them if they're developing early, so they don't get into this full-blown picture, or can we come alongside some of these more advanced rheumatologic drugs and get people feeling better while on lower doses so they're not escalating year after year? As you said, chronic gut problems. I specifically love working with people who have just been given the diagnosis of IBS, right? So that's a functional gut problem, meaning like, we don't know why you feel this way, good luck. And there are all kinds of underlying root causes for that. So that would be another one. And then anything hormonal, especially I would say women in general, by the time they're in their late 20s to mid 40s, have had some hormonal concern. And the answer from primary care is like, we don't look into that stuff. Everything seems fine. So yeah, a lot of different things functional medicine can do, and you'll find different physicians in the functional medicine world really, they either are a sort of a functional medicine generalist and sort of do it all like root, or they may say, "Hey, I only treat thyroid disorders." So yeah, some people narrow down even further.
interesting. And I know there's a lot of lifestyle factors like sleep, like adequate nutrition that we discussed, adequate exercise, things of that nature that are largely in our control. And when not properly accounted for, can lead to metabolic dysfunction. Would you agree that metabolic dysfunction lies as a foundation of most preventable chronic diseases that we see, like diabetes or hypertension, so on and so forth? Would you say that if the metabolic dysfunction could be addressed early on, that a lot of those chronic diseases that we see could be prevented?
Yeah, I don't have like a good, the 80% would be better if we could, get rid of the metabolic dysfunction. Because there certainly are still cases of named diseases that, you know, do have a strong genetic component. So I don't want to disregard that. But yeah, in general, metabolic disease can be prevented with proper nutrition. I will say I think that medicine underappreciates the role of stress in the evolution of chronic disease.
Mm.
Especially currently, our society is all about, more like what can nutrition do, right? Healthy eating and exercise. But I have worked with numerous members who, man, their diet looks like pretty awesome. And they're like doing CrossFit 6 days a week and they develop a metabolic disease. And I'm like, do you sleep?
Yeah.
How stressed out are you? And I think that we underappreciate the role of stress and what it can do to our bodies.
Yeah. No, it's important to consider in the holistic balance of your health. Like you can be go, 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 but then if you're not sleeping, you're just going to crash, right? So, to go even further into addressing root causes with preventative medicine, one of Root's missions is to address the quote root cause rather than just manage symptoms, as we've been discussing. So, can you walk us through an example of a particular case where getting to the root made all of the difference for a patient?
Yeah, yeah. Actually, yeah, a good example is we recently on our Root Functional Medicine podcast interviewed a patient from a few years ago. So her story is online if anybody's interested, but she came to us after gosh, I think she is a few years out of college, so in her mid-20s and had gained like 60 pounds in the course of a year. And she was obviously concerned. She was an athlete in college, and by the time she gained all this weight, her primary care doc was like, well, you're not in college anymore. You're not at practice every afternoon. Like, this is what real life looks like. And just sort of given the brush off. And, there's a few different things to think through when someone's gained a lot of weight. And I met with her and I was like, well, maybe, you do have to think about lifestyle. Is it that, right? And I said, but something's not adding up here. Like, that's a lot in 1 year, right? A lot of weight gain. So we did some, basic testing. So some blood work, but we also threw in some cortisol testing, more of a functional medicine approach to see what stress levels look like. And her levels were incredibly high and we ended up figuring out that she had Cushing's syndrome, so evidence of chronic high cortisol levels that were due to a pituitary tumor. Got her to the right folks because obviously I'm not the person to remove a pituitary tumor. And within, months after her surgery, finding what the root cause was and removing it, her life returned to her like college weight and her life returned to normal again. So the treatment itself, although surgical, like not a quote functional medicine treatment, it's important to note that like if somebody just says, oh, like this symptom is quote normal and you don't feel like it's normal, then you need to find somebody who's gonna start hunting for that root cause.
Wow. Yeah. So she was an athlete in college. Shortly after graduation, she had gained 60 pounds in the course of a year. Went to a doctor who just kind of brushed off, like, yeah,
Yeah.
exercise some more, maybe eat a little bit less. She wasn't satisfied with that answer, came to you folks, and through some more thorough testing, found elevated cortisol, which pointed to a tumor on the pituitary gland.
Yeah.
And that obviously did it have to be removed by a
Yeah.
neurosurgeon? Wow. Wow. And then after that, she was back to normal.
Yep.
Jeez,
The
that
root
is
cause
cool.
makes all the difference.
I mean, I wonder what would have happened if she had never visited your clinic.
Yeah, I guess I've never thought through that. Cushing syndrome does get more dangerous than just weight gain. So I think if it was to go further, right, she would have had more significant symptoms that would have probably been more chronic in a lasting sense, even post surgery. So, yeah, I mean, I'm always happy when I can pick something up early and that it's a fixable root cause and get their life back to what they expected.
Yeah. And so Cushing syndrome, is that what describes the tumor on the gland itself, or is Cushing syndrome the elevated cortisol?
Cushing syndrome is the elevated cortisol. And then once you say, hey, this is an elevated cortisol, then you've got to start searching for where that's coming from. And sometimes it's the pituitary and sometimes it's the adrenal gland. And hers was a pituitary tumor.
Interesting. Very interesting. Dr. Cordes, a lot of patients are overwhelmed by wellness advice online, but could you just tell us what are some of the core principles of functional medicine that you wish everybody understood? Some things that really move the needle for long-term health.
Yeah, yeah. I think it is a lot simpler than what the world is making it. Yeah. It's food, right? So it's nutrition and it's the day in, day out stuff. It's not the one Saturday night you went out for margaritas and tacos. That's not gonna ruin it, right? It's your day to day. It's exercise and movement, and it's how you control your stress and sleep. It's not, in a grand scheme of things, it's just those 3 things. Now, when we start working with members, right, we really dig into the weeds of what that means. So I don't wanna oversimplify that it's just eat healthy, move your body, and sleep adequately. But if you're generally healthy, that's the approach.
Absolutely. So yeah, it's sort of along the line of your habits. It's not so much the outliers that come in now and again, but it's generally, are you consistently sleeping adequately? Are you consistently eating good? Are you exercising regularly? And those are just some of the most important things to look at if someone just wants to be generally healthy. It's like foster
Yeah.
some good, consistent health principles.
Yeah. And I think if you were to ask physicians 100 years ago, it probably hasn't changed.
Yeah, I believe it. I believe it. So moving on to your personal approach
Mhm.
to this,
Yeah.
how do you personally approach your own health and self-care routines, and how does that inform the way you care for your patients?
Yeah. So in general, it's those 3 things, right? So I guess in my life, from a food perspective, the simplest thing I can do is just follow what Root Functional Medicine RDs tell me to do, which is great, right? So being part of the Root membership allows members to, and obviously Root physicians, to access our meal plans that our RDs make, and it's a macro-based program in some ways, where protein, fat, and fibers balanced in there, some carbohydrate, and the plate in general is pretty balanced and you're not weighing things, and it's all meal prep based that I can do a lot over maybe like a Sunday afternoon and be prepped for the week. So pretty simple there. I don't get real fancy with crazy foods and additives and supplements and all that crap. I'll occasionally do protein powder if I'm really desperate, but not very like I would rather eat whole foods. From a movement perspective, so I work generally I'm in telemedicine, so I work a desk job, which, not great, right? Like we all know that the studies on sitting down all day are just like smoking. So most of the time, not today, I'm at a standing desk and I walk between patients, and then 3 days a week of strength training and 3 days a week of hot yoga. There's been times in my life where like I ebb and flow with that as far as like, if you want to do a triathlon, you throw that in for the season. If you want to get into CrossFit for a while, you do that. Like I want to be able to do, jump into these things to stay ready for that kind of thing. But in general, it's more just yoga and strength training. And then like from a sleep and a stress perspective, my sleep regimen doesn't really change unless I'm traveling. And I think, stress, being a physician is stressful from time to time, right? So I think a lot of it is, I think sleep is a big deal here, that I can't de-stress if I'm not sleeping. And then for me personally, exercise is a big de-stressor. So yeah, I mean, nothing real fancy there. I don't think it's fancy.
Yeah, no, and sometimes simpler can be better.
Yeah, I think you'll especially get when you get into like the more of the physician like wellness world. And I'm sure if you're on Instagram with all these influencers, right? People are always marketing some new tool, some new thing to do, some hacking thing that you can take 20 years off your biological age and now you're 16 again. And I always question like who's getting rich off this scheme because I don't see evidence for it. And I think that people get attached to those real expensive, fun things as a toy, right? But if you don't have the basics down of movement and good nutrition and good stress, that little like extra thing, so sauna practice, cold plunge, all of that stuff, it's not going to move the needle. It's very expensive.
So, at Root, nutrition is a key focus.
Mhm.
What role do you see food playing in preventing disease, in reversing disease, and how do you discuss food with your patients who are used to getting prescriptions rather than discussing nutrition?
Yeah, food is obviously the foundation here. I luckily have an RD that does a lot of this, but most people that come into functional medicine, most patients are relatively disillusioned with the sort of pill for the ill mentality, right? They've gone to their primary care doc and they have not been satisfied with either the here's your pill and then they don't feel any better, right? Or like, hey, I can't help you. So most people are pretty open, and I feel like society in general really is talking about the role of food anyway. So I don't feel like we get a whole lot of pushback. When we talk about nutrition with folks, it's important to understand where people are coming from, right? So if if someone's eating sort of an on the go gas station McDonald's type lifestyle, to take them from that to like a full what we call root plate, which is macro based within 1 week, not going to happen, right? So what can we do to change breakfast, right?
Right.
And let's get that habit down. So it's a lot of habit stacking. Humans in general don't change fast. We've got to do small little incremental movements. And that's what RRDs are so good at, getting down into the weeds as far as, what can be changed on okay, this week we're working just on this. That means you got to eat breakfast, or you gotta cut down on coffee from 8 cups to four. Like some of these small goals, and then they're additive. From a nutrition perspective, it is just important to hear people out about where they're at. And eventually we get people on the root plate. So that's a proportion of real, like animal-based protein, a good amount of fiber, fat, carbohydrate that everyone thinks is low, but it's not low carb, it's normal carb. But that balance, right? It balances blood sugar throughout the day. And from there, we tweak things. There are certain conditions that do better. More plant predominant, less meat, more meat, intermittent fasting. So, that's more of a individual way of looking at things. But we usually start off with what's called the root plate, which is a balanced nutrition approach.
Excellent. So, for somebody who wants to get into functional medicine but doesn't quite know where to start, what kind of advice would you have for them?
Yeah, get through medical school and residency in a traditional sense. I think that although this field it's so rewarding, honestly, but it's rewarding because I am traditionally trained to start with. And I think that's important. A lot of practitioners and maybe outside of your MDDO world, right? They jump in with very little education and they say that they're doing functional medicine. And I think it is a misnomer. Yes, they could appropriately probably talk about sleep and nutrition, etc. But the differentiator is that like I can still make a formal diagnosis of a medical problem and I can treat it appropriately and get people in to the right person, right? So that example of needing a neurosurgeon. And I think that especially medical students that maybe want to go this way, don't bypass traditional residency. You learn so much. You want to be able to help people who are generally well, but not feeling great. That's great. We can optimize, but also you don't want to miss a diagnosis either that is life changing for somebody. So you still got to like sort of earn your stripes along the way. So pick up as much as you can in those residency years, medical school and residency.
Awesome. Yeah, great advice. Stick with the traditional path and then dive in if you want to.
Yep. Yeah. So I see functional medicine a little bit like going to fellowship. It's not a alternative to formal residency training. It is a post residency pathway. You got to have your basics down.
Absolutely. So, Dr. Cordes, the mission of the physician's mind is to give successful people a platform to share their experiences and advice to help the curious mind optimize their journey of lifelong learning and self improvement in medicine and beyond. Do you have any last pieces of advice in line with this mission that you would like to share with the audience?
Yeah. I think if you're working in an environment, working in an environment that you think needs improvement, it's okay to go improve it and to not just say that that's the situation that healthcare is in. I think there are a lot of courageous physicians out there right now that can see that the American healthcare system is not built correctly and not sustainable financially. I think we know that, right? But also not helpful to individuals. And I think, that courage of saying like, this isn't right. It's not ethical. Doesn't help people. Someone's getting rich, right? Like, it doesn't feel good. I think, it's okay to be like, this isn't working. I got to build something better. That's how Root came around. Like, we got to do something better for people. So,
Boom. Yeah, don't be afraid to be an innovator where something's lacking.
right, right.
Awesome. Well, thank you so much for joining me and sharing your thoughts on functional medicine, a little bit of your journey, and some of your advice. Much appreciated.
Yeah, of course. Thanks.